Good morning.
Good morning, sir.
Are we ready for this lecture? I will share this desk with you. Am I permitted? Thank you. All right. As I was saying, the quiz is actually, if you look at it, the title, you find out that it's assignment what quiz, because this is an assignment I gave you to do what to do. You know, we have quiz as in quiz. Then we have assignments as an assignment. Then we also have what assignment what quiz. That's why I gave that to you to study it on your own, research on the answers on your own, and if you actually did that on your own, you'll be able to write it in the quiz. Three of us, you'll be able to write it. So I did that. Some of you didn't take it seriously, and that's why some were scoring 3, 4. Some could not even finish because of what? They did not do that. I don't know their reasons. Then some were scoring 19, 18. It shows something. Am I communicating? It shows so, and the idea is not for you to fail. No, the idea is for you to understand. If you actually did that thing by yourself, my mission is to put this in you. It's not to stand as an umpire looking for you to fail so that it will be you have F. No, the idea is for you to know that thing, and that's why I adopted that pattern. Give it to you. So you do what? Research it. I'm not saying copy answer from someone that did. But if you copy answer from someone that did, without understanding it, if you come to the exam, you still fail. The only thing you may do is to you start looking for how to copy that answer and come and do it. If you do it, you will still fail because I will catch you. Am I communicating? And you don't even know if the question will be twisted. So if you just cram the answer like that and come to, you may score 0. Am I communicating? So the idea is, if I give you any revision questions, try to. The world is in your palms now, 3 of us. Yes. So what's your problem? You try to do what? Research on it. You research on it. Because we are researchers. Because when you start facing challenges from your patient, you know that how the importance of doing what? Carrying out what? Research. Nobody will do it for you. You research to solve a problem. Because if you fail to solve that problem, the patient will not come back again. And in fact, he will do free advert for you. He will do free advert for you, telling the whole world that you don't know what you are doing. So if you don't cultivate that habit of carrying out research on your own, you may not be able to, you will not go far. So you need to learn it from them. That's why I do that. I give it to you. Research on your own. Find out. Then if you're after the quiz, by God's grace, if I make out time and do revision, it will enter well. Even if they wake you up without even going through your notes and wake you up to give you exam, you will write the exam. Why? Because the thing has entered your subconscious mind. It has entered your residual knowledge. It's not just what you just cram and pour for the purpose of what? Quiz or what? Examination. By the time you are cracking your brain, finding the answers, the thing is entering. Some of you that scored 19 in that quiz now, believe me, if I start them up now and answer that question, they'll be able to answer it. Why? Because they actually did that thing. They research, they solve the questions themselves. It's as simple as that. There's no magic there. Then those that did not, they are scoring below 10. They didn't do much. Maybe they didn't take it seriously, or maybe a day to the thing, they just rushed and looked for where you copy those that did it. And some of you, we are using the same note they used to solve that question. I just intentionally kept quiet about it. If I see it again, you score 0. Some of you, maybe the same book they used to solve maybe research about the thing, that's what they used to write. If you do it again, please, if you are among those people, please tear up that thing and don't try it again. Any private studies, do it your private studies with your rough or with your notebook. Am I competing? that exercise book is for your, it's not for your studies. I just intentionally kept quiet. But if I see it again, the person will score 0. Are we together? Then apart from those that I called, I will still find out what type of material they use for their quiz. Some use yet some one human being use nursery school, that thing they used to learn how to write ABCD. What about nonsense is that? Since we started this class, I intentionally, apart from helping you to learn, because if you are in class and you are copying notes, there is this thing, that note you copied, you have read that material once. You have read the material once. Then when you now open it again, it will enter for the second time. Are we together? And apart from that, I try as much as possible to limit unnecessary costs on my students. So if I had prepared handout, you know how much you pay, 3 of us. Then is it buying 14 is your problem? Why are we not appreciative? Is it buying 14 is now your problem? Does it make sense? How much is 40 leaves? No, what's your problem? Buy something you used to, because if you buy it, you only have the questions in soft copy and you answered it. Then if we do revision, you also put it down. Then correction, right? Then when you want to study towards your exam, final exam, you can get those materials and cross-check the answers again. There's no way you cannot get A in the course. It's not possible. And those that have built themselves with exam malpractice, you see no need for what? Exam malpractice. Because you have what you need to study. The class was duly explained. The topics we are duly explained. 1. Secondly, you pass through hurdles of continuous assessments. Before you pass through all these steps, the thing would have entered, even if you are the worst. Even if what you carry in your head is tabula rasa, nothing is there. There's no way you will not do well. So please, I beg you, let's do the right thing, okay? All right, now, give me marker, please. Marker. So where do we stop? We'll start from where we stopped, right? Where exactly did we stop there? Hey, don't mind me. Give me. Please give me. Hey, the brain is fired, early morning. Now, wow. This early morning. All right. So we are still discussing the what? Rules of what? Rules of what? Pharmacist. Good. Specifically, we are talking about the rules in what? Community what? Pharmacy, right? Yes. Good. So where exactly did we stop there? Okay, so let's continue from where we stopped. All right, put this down. With special training, that's the D part, right? D, right? We stopped at C, right? Yes. So we'll start from D now. Yes. Yeah. So okay.
This role, so I want to ask, in the pharmacist, does it mean that all these roles are they studying it? Like, can people specialize on it each?
On the rules?
No, like for example, as you say, community pharmacist and industrial pharmacist.
Okay.
In pharmacist field, like I'm talking about faculty. as they are there like that, like someone that wants to specialize in.
In faculty, what we have in faculty is, thank you for that question. In fact, when it comes to the faculty of pharmaceutical sciences, as far as Nigeria is concerned, most of them have up to, some have six departments. In that department, you start seeing things like Department of Pharmacology and Toxicology. You start seeing things like Department of Clinical Pharmacy and Pharmacy Management. Some schools have it as Clinical Pharmacy and Pharmacy Administration. And we also have Department of Pharmaceutical Chemistry, Pharmaceutical and Medicinal Chemistry. Some also have Department of Pharmaceutical Microbiology and Biotechnology. They also have the Department of Pharmaceutical Technology. Some have it separate, some have it as combined with pharmaceutics, Department of Pharmaceutics and Pharmaceutical Technology. These are departments in the higher institutions. But, like, as you said, now we have, when you now come to the rules, we have industrial pharmacists. Am I communicating? Now, your knowledge of pharmaceutical technology and pharmaceutics will help you to do well as an industrial pharmacist. Am I communicating? Then we also have community pharmacists, those in the community. Your department in all the fields self will help you do well. You know, these things are intermingled. Am I communicating? Now, your knowledge, your overall knowledge will help you do well in different areas. Like for me now, because I'm here, by virtue of being here, training you people, I am an academic pharmacist. Now, you know, as I'm training you now, your training here is now general now. It's not specific. Now, my knowledge in all the departments, remember I told you that pharmacy is an integrated course. My knowledge in all these departments now will now help me to form you well. Apart from what I did in school, my courses that I did from all these departments, my experience, I told you I've worked I've worked in industry, I've worked in community, I've worked in hospital, I've worked in the field as a medical sales rep. All this experience plus what the one I gathered in school is helping me now to form you, to train you as a pharmacy or technician. Am I communicating? So those departments help each of these areas. We have community pharmacy. We also have veterinary pharmacy. Those that are focused on veterinary drugs. Am I communicating? So that is that. Have I answered your question? Now, let's continue. So with special training, with special training, yeah, D part. You ask because like someone that just woke up from sleep, and she's still talking. With special training, okay, they can manage asthma. Yes. Diabetes, asthma, diabetes, hypertension. You don't want to see handwriting. Now continue. Asthma, diabetes, hypertension, and the other chronic diseases. Diseases. That's why if you go to community pharmacy, they will check your BP, right? Check your BP. They'll tell you, okay, come tomorrow morning, come so day, come again. They keep managing the patient. Am I communicating? Yes, they can do that. Are we together? The same thing with the diabetic patient. They'll tell you, come around 7 or 8. Don't eat anything. Come. They will test your blood sugar, review your medication, see whether, have a chart, whether it is going up or it's going down. If it's going up, they'll find out what other things they are doing that is making it to do what? To go up. Then if it's going down so fast, they also, because some of these patients are funny. If you're not careful, they'll put you in trouble. So after coming to you to give them to monitor their what? Sugar level for them. They will still go back and start taking all these herbs that bring down the sugar level, and they will not tell you. So that's why you should ask question, monitor them, see how you see, have a chart of how this is. Don't just do it anyhow. They come, you do it, they'll go. No, one day they put in trouble. Find out how, have a record of their sugar level so date. You see that's how the thing will go down. You'll be like, this drug I give is not enough to push it to what's going on. You start asking questions. Are there other things you are taking? Some of them, if they open up, whether that they take some of these herbs that bring down what? Sugar level. Then after taking it too, they'll come to you. Some are also doing fasting, maybe in their church issues, church program. They are fasting and they are taking those herbs, and they are coming to you for what? Drugs again. If you're not careful, the person may become hypoglycemic, and from there, coma. From there, you'll be like, hey, he just came here, and our sugar level has been normal. I just gave her, hey, they didn't tell you what has been happening. Then if it's going up, you start asking questions. Are you taking your medication? Okay, tell me, how do you take it? Not are you, because if you say are you, he will say yes. No. When did you take it to today? That's when the truth will start coming out. When did you take it today? It's not are you taking it. If you say are you say yes, I'm taking it. Case end. Because to them, they don't want your wahala. You tell they ask. You tell yes, I'm taking it. So I will not see how the training will help them to do what? Manage this what? Patient. Let's continue. The E part. They help people give up smoking. They help people give up smoking, alter their diets, alter their diets, to make them healthier. Alter their diets to make them healthier. To make them healthier. Full stop. They also advise on sexual health matters. Full stop. They also advise on sexual health matters. Sexual, sex, from sex. Sexual. Health matters. Sexual health. Why is your face like that? Sexual what? Health matters. That one is clear now, right? Yes. Apart from, it's not there. This is why we are doing. You do primary health care in your second year. That's what I mistakenly wrote on the board. But that's what I'm teaching them now in second year. So that's what came to my brain. I wrote it on the board. So your knowledge the knowledge you gather in primary health care will help you in health promotion, because this thing I just called about now is health promotion. Hope you know. Preventive what health. True of us. If I'm promoting health, advising them, you tell them what and what smoking can do to their what health. Even we are too stubborn. Even in cigarettes. Let me use cigarette as an example. Even in the packets, some buy it in packet. Even in the packets, they will put pictures of normal lungs and the one that is messed up. But people don't listen. They will still buy it and be taking it and be smoking it. They say now putting mouth ulcer, mouth cancer. Say people don't even care. Am I communicating? So to tell you how determined people are to keep smoking cigarettes, but you also as a community pharmacists or pharmacists working in community setting, you have to also tell them, make them realize that thing they see on the packet that is real. You know, gradually, those that want to listen will listen, and you gradually, they withdraw from it. You know, it's what you withdraw step by step. It's not just what you stop like that. Am I communicating? So gradually they will do what? Stop it. The same thing with sexual health. Of course, now you get your knowledge will help you to tell them about, okay, they come to you all the time. They come for one some may even start coming for abortive what patient. Am I communicating? You counsel them on what they should understand, so that any decision that they're taking, what's that? Is it question that you cut me off like this? I'm talking, you cut me off. I thought maybe she want to take permission and go out. I ask. Ibu. Is it medicine? It's a drug now. There are things they use cannabis to do what? Produce. Well, that's smoking it. Do you know the dose you are taking? That's the problem. If it is used to prepare medicine, that's about it. It's been studied that this is the amount that we use to prepare a medicine. True or false? You that is smoking it, do you know how many you are taking in your system? That's the problem. In further to what I said about drugs and medicine, do you know the amount that you are consuming? You don't know. A lot of people are on the street mad, ravingly mad. Do you know the amount they took? That's the problem. Some of them come from family that anything is not in their line. Did you know? His friends are smoking. He's destroying our youth. And most people that get exposed at tender age to it, most of them, their life is scattered, wasted. Most of them, their life is what? Messed up. For real. Those that started from tender, but there's nothing else they're thinking about is how to feel good. Is what will make them feel good now that they're thinking about. There's no reasonable thoughts on how to do something meaningful with their life that will come into their mind. Am I communicating? So that's why the government is against it. Am I communicating? It's not as if do you know the amount you are consuming? You don't know. The same thing with what? Cocaine. The same thing with what? Cocaine. So that's why it's what? Drug what? Abuse. That was what? Drug what? Abuse. Most of these people you see on the streets, greater percentage of them is from what they. Yes. And you can't just start giving dollar that you gradually you have to, the person you are talking to have to believe in what you're telling him. True of course. If you don't talk and start giving anything, they will not take it. Huh? Yes, yeah. Am I communicating? But the point is that they should first of all understand what they are saying. If someone doesn't understand, believe in what they are saying, give 1 million drug, that shit for free, you carry it away and do what? I continue his life. Am I communicating? That's why it's not just about giving drugs, it's health promotion. Sit down with them, make them realize, and it's not what you can do today, it will happen today. Some may even run away from you for even bringing it up. Am I communicating? Please, let's continue so we don't waste time. The next one says, that is F. F, yes. They play a key role. They play a key role. A key role, yes, in helping people make informed decisions. They play a key role in helping people make informed decision. They play a key role in helping people make informed decisions. Informed decision about what? Self-care, comma, about self-care, comma, are we there?
Yes.
Are we there?
Yes.
All right. About self-care, comma, and in providing and interpreting the information available, and in providing and interpreting the information available. So what are we talking about here? Not everything concerning how you take care of your health that you go to the hospital. Hope you know. Are you aware? So you don't need to start going to the hospital to know that you should wash your hand. True of us, before eating, right? Or you should wash your hand when you come back from work. You should do what? Wash your hand before anything, right? So maybe somebody presented with see how this one is sitting. Sit well, please. Take chair with take. Are we together? So it's not everything that now maybe somebody may be presented with maybe diarrhea. Am I communicating? Diarrhea. It's not just about giving person drug and that's the end. No, you should go extra mile, right? Find out possible cause of that what? Diarrhea. Yes, you can give medication, you can recommend medication for immediate what? Treatment. At the same time, find out the person's hygiene level. Do you wash your hand if you come back from work or before eating? Or do you, so some of you will come here, even here, some will come. That your hand you use to clean one dirty rag, you use it to clean the table, right? Then you see buy gala or buns. That same hand, you are eating. You used to be eating buns here or doing break. That same hand, your mind didn't even cross. You didn't cross your mind that I've messed up this hand. So we shake your classmate. You shake them. Maybe that person just came out from toilet without washing his or her hand. You don't shake a person alpha. The person is eating buns. You just person you cut your own with that same hand. Am I communicating? Tomorrow you rush to the pharmacy. I don't know from nowhere. I don't know how it happened though. I just started the pooing. So you should find out possible cause of. It's not just about selling your drug. You go beyond selling. It's not just about making your money and profit. Go beyond that. Find out what is the issue. How do you the person may start me, yeah, it's true. I don't wash my hand though. In school I just eat buns anyhow. I just do this. The person will start doing what? Doing those things. The person will start doing those things. Self what? Yeah. Am I communicating? So there are a lot of examples. So these things are services you can do what? Offer in what? Community what? Pharmacy. Are we together? Are we together? All right. So the next one. Yeah. All right. Some community pharmacists. Yeah, G, yes. Some community pharmacists own their business. Own. Some community pharmacists. Some community pharmacists. Sorry. Own their what? Business. And enjoy the challenges are we together? And enjoy the challenge. Enjoy, please. Enjoy of financial management. And enjoy the challenges of financial management and responsibility for staff. It's because your mind is telling you something else. Do what I said, then you'll be happy. Your mind is telling you endure. That's why you're confused. But I told you enjoy. Or financial management and responsibility for staff. And responsibility for staff, comma, stock, sorry, stock, as in stock, stock, S-T-O-C-K, stock, stock, are we there? And premises. That this brings that this brings here. This brings. This brings. Yes. Hello. I like that. I'm happy. I'm happy. Most of you know what you are doing, but the problem is that maybe because of time to study. Yes, but we have to do what? Do it, right? We have to do it. We have no choice than to do what? Do it. So let's go over this last one again. Let's go over it again. Someone should read for us.
Some community pharmacists
I said one person, please. One person, please. It's okay. It's allow her, please. Hey. Wait.
Some community pharmacists own their business and enjoy the challenges of financial management and responsibility of staff, stock, and premises This is
Staff. Staff. Four. Now, when you own business, hello. Some of you are saying endure because they see what challenges. Now, you own a business, right? Everything that comes from that business, you enjoy it. True of us. Yes. You enjoy everything that comes from that what? Business. Am I committing? Whether good or what? Bad. True of us. It's not just about you don't run away because will you run away? You are there. Because those times it was good, you may have made over. Then when it becomes bad, remember that there was a time it was what good. Use the surplus of when it was bad to make up when it becomes of when it was good to make up when it becomes what bad. So you are enjoying, you enjoy it, and that what makes you a responsible and a very dedicated how do I put it, a good entrepreneur. Am I communicating?
yes.
You don't. Yes, there are some people that because they have a business, their staff, they started have been making money for them. I'm talking about staff because there's a place they have responsibility of what for what staff. Because some of you tomorrow may be in that shoe. Anything you are doing in this life, remember that people, if you have people working under you, remember that there was a time, all those times business is booming. These people were the one that did that for you. Am I committed? Without them, you cannot, you couldn't have got to that what extent. True of us. Now, maybe just because things is not going the way you wanted it, you planned or budgeted or planned for it to go, then you now some will now even go to the extent of slashing their what pay. Am I communicating? But he forgot that there was a time that they made what was even almost 100 times more than their what pay. A good entrepreneur, see what he does before the beginning of the year, end of the year, he will check the total whatever he or she made. A good entrepreneur that want to go far, what he will do is this: for the next year, the first thing he will after from the profit he made last year, net profit, before buying that land, buying that car, doing taking that chieftaincy title in the village for 56 months, sharing bags of rice to widows in their village. You therefore bring out the salary for his staff for the next 1 year and keep at the side. Someone that has foresight, bring out everything that has to do with benefit of the staff from that profit and keep one side. If he needs to employ more staff, you know where his business is going to. He will plan for what he needs for his staff and keep. Then anyone that's money, he can buy that land he want to buy. He can buy that car he want to buy. He can buy whatever he thinks he wants to do. Then know the one that he plow back into his business. For those that don't collect their own what salary, but there are those that collect their own salary. Whatever they are spending will be within the limit of their what salary, unless whatever land they are buying is for business purpose. If it's just for personal life, they will manage based on their what, and that is even the best. Am I complicated? Any other one will plow back to the business, but first of all, he will bring up what he needs to take care of his staff, because these are the people that generate that money. Even when things began to, stop moving the way it was for that year, his staff will be will be okay. And believe you me, yes, there are people that are not, there are people that are ingrates. Such people exist, but generally, greater percentage when other people are complaining that they slide their salary and their own boss, even when they know that the company is facing crisis, they didn't touch their salary. There is this renewed zeal and motivation. Some even go any extra mile. Those that believe in all this spiritual will go there to make sure that the orga is doing well because of how he or she takes care of what them. But sometimes we forget that majority of our companies don't even look into that. I'm talking to tomorrow you will become one. But as I look at your eyes now, your eyes are weird to how to start your own. Tomorrow you may have even if that staff is all these small people you are paying 20k, 30k, take care of them. They will go extra mile for you. As in, they will go extra mile for you. Some you may even beg them to go home. They say, "Ma, I'm not going home. Ma, I want to work more." Even if some I've seen it. Even some doing Sunday, doing weekends, they say, "Go off, ma, I'm not going off. I'm coming to work. What am I doing at home?" But there are some you begging them, you have an issue with them, they even come to work on time. These are one thing most people don't understand. So these are all about the responsibility of taking care of your what, the staff and whatever that is. So yes, there are people that are criminals on their own, those one day, but majority are not like that. If you do the right thing, even to the last kobo, they will tell you, they'll give you your money to the last kobo. Your stock you have, they will give you. They may even spend their own money trying to make just cause. They don't even mind because they know that the person they are working for knows the right thing to do. These are small things people ignore. They take their staff as their slave. You treat them the way you like. Don't worry. One day they will go, you go and bring one criminal. Then you understand. You understand what business is. Or someone that will even kidnap yourself. Of course, they do it now. Now. He may even be discussing with his friends, with criminal mind. Nah, this is my madam. Very, very wicked woman being. He doesn't do this right. They may advise the person, and you are, what are you telling? And if it's someone that doesn't think straight, you want to do what? It may not be his or her original plan to do it, but because of peer pressure, and also because of you are not treating the person well, you start hearing the news. Hey, that one staff killed her. That one staff did this to her oga, madam. How? You don't know the full story. I'm not supporting that, but I'm telling you what you would do. There are some things. Being good is very good. It's good to be good. There are some things that you will escape. Yes, people must have treated you. Other staff you have employed must have dealt with you, but don't change who you are because of what people have done in the past. Treat people like human beings, and you see your business. Even goodwill. Do you know you cannot buy goodwill? Do you know that we are gods? Our hearts, our mouth is powerful. If I'm with you working for you, even if I'm your wife, I'm working for you, and I'm happy with you, things will be going well with you. You know, I'm not going moral now. It's very important to go moral sometimes. Things will be going well with you because the person is happy and you are just. And that's how you, even if you are punishing that person for what he did, the person will be happy. They see the punishment because he knows that me, self, I fuck up. This woman doesn't deserve this thing I did. He will even punish himself for doing that thing just because you've been good to him or her. So let's continue. In case tomorrow you start your own business, or that is if you have not started already, You know how to take care of that your nursing assistant. Some of you will just be paying them what you don't know. And the person is coming from far. If you ask us, how does the person come? All these small girls, you will get the 10,000, 20,000 a month, 30,000 in a month, and the person will eat, and the person will stay for you from morning till 9 p.m. The person has no life outside their pharmacy or outside their hotel mess, no life. You do that thing for like 1 month, you carry 30K and give the person, because the person is studied 2-year course and is working for you. Have you asked yourself that questions? You are training a professional shower to work with you, because she must survive. Transport fare to where he's coming. It's not your business, but you want him or her to stay with you from morning till 9 p.m. It's not your business. Since you cannot pay, you don't have what it takes to pay more, why not allow the person to work from morning like to 2 p.m. or 1 p.m. and know whatever he or she want to do with his life? Why not leave him maybe Sunday, Saturday, Sunday, don't come work from just, since I cannot pay, know what you can do with, find other places you can make it up. But you will seize him or her, you will work for you. To you don't care. If you talk too much, you say there are people are bringing applications, so you don't care. People are hungry, so you don't care. Because soldier go, soldier come. The barrack is stay what? Don't worry. One day all the soldiers will go. The barrack will remain empty. You will not realize that. You will not realize that to get people to work for you, you know the meaning. You know, when you face the challenge of loyalty, then you understand that soldiers may not come to feed that your barrack one day. There may be soldiers on the street who because but you are looking for a loyal soldier. Your barrack will remain what? Empty. Because the soldiers will will carry your ammunition and be running away. Then you realize that loyal soldiers are not where to be what? Then and because you want loyal soldiers, your barrack will remain what? Empty. When you want to go to meeting, you lock up your shop and go, and you are losing business. You are losing money because out of your foolishness, you couldn't add up to extra 20K for that one that is loyal for you. You couldn't do it out of selfishness and greed and wicked mind. You couldn't do it. Then when you lose them, you start locking at your office because you are afraid that those you bring may deal with you. By the time you lock it a day, 2 days, you are losing money. You are even losing more than what you would have added to that one that is loyal to you. I know that I'm speaking to the mindset of some people. I am for real. And as I see this now, their body them. Sex girls are not wicked. That's a wrong statement. Anybody that says that sex girls are wicked is wicked. You can say that some people are weird. I understand that one. That's a wrong statement. That's a wrong statement. See, the mindset you have towards people, that's how they follow you. The mindset you have towards people, that's how they will follow. I don't know why I'm saying this, but it's one of those things. Those already do, because anybody the body is peppering is a victim of is guilty of what I'm saying now. Repent. All right. Hey. Don't ask me. All right, let's continue. Private. The message I pass across is clear. So anything should be what? Private. Are we together? Okay. All right. Specialty pharmacist. Specialty. From special, yeah. Specialty pharmacist. Specialty. Yeah, this one. I've been carried away with what is in your mouth. If you forgot where we are. We are number what? Tell her, please. Have you heard it? Specialty.
Specialty pharmacy.
Are we together? So, as in, put this one down straight. Straight up. This one is simple. We just straight up. No ABCD. Because I know you are tired of all this ABCD, and you are afraid of it. You are afraid of. I know. You don't want to hear I. You are afraid of it. I know you don't want to hear it. Let's see. Okay. All right. Let's put it down. Pharmacist with special interest. Pharmacist with special interest. Pharmacist with special interest. Focus on expert areas. Pharmacists with special interest focus on expert areas like pharmacists with special interest focus on expert areas like cancer, comma, diabetes, comma, thank you. Blood pressure checks. Yeah, check as in CHECKS. Blood pressure checks, comma, checks as in checking something. Yeah, blood pressure checks, comma, cholesterol screening, and more. Cholesterol screening and more. Full stop. Are we together? Full stop. Is it clear? This one is clear now, right? They focus on these areas. That's why they are special, okay? Yes. Even though, yes, their practice is there, but this is where they and are doing well there. You know, specialization is very, very good. It's a good thing. Anybody from anywhere will come into you because this is where you do what? Are we together? Now, the next one, hospital. Is there ABCD? So we're happy now, right? Yeah. Hey. Number 6. Yeah. Number 6. Hospital pharmacist. Hospital pharmacist. Hospital pharmacist. Pharmacists, or simply write they. Right, use they because we know we are talking about what. You use the pronoun they because we are talking about pharmacists, right? So use they. So we cut long story short. They compound medications. Compounding, from compounding now. You thought about compounding, right? Yeah. They compound medications, comma, work in hospital pharmacies, not pharmacists, comma, and even participate in patient care management. And even participate in patient care management. And even participate in patient care management. Full stop. Yes. Care management. Yes. Within the hospital practice, comma, within the hospital what practice, comma, yes, within the hospital practice, comma, some pharmacists specialize in specific fields. Remember, we are talking about hospital properties, right? Yeah, within the sphere of the hospital work practice, some pharmacists specialize in specific fields like hematology. What's the problem? Huh? What did I say after that? Tell her what I said after that. Specializes in what? In specific fields. In specific fields. Specific fields. Like let me advise you. Listen. Let me give you a secret to things like this. When I'm calling out things, try to let your attention be here, and as you are listening, try to reason it. Am I communicating? As it's entering your ear, process it as fast as possible. Try to understand it as you even as you are listening. It will help you to know exact. So it may not exactly be. You may not write it exactly as I call that. Am I communicating? The basic thing is to do what? Grab the message. Are we together? That is the basic thing. To grab the message. I said that within the hospital practice, that some pharmacists specialize in specific fields like hematology. Hema. When you say hematology, what comes to your mind? Who knows? Tell us. Who knows? Blood, right? Yes. Good. So you can put in bracket what? Blood to help you. Hematology, comma, cardiology. What comes to your mind? Comma, geriatrics. GE. Yes. Geriatrics. GENERIATICS. What's that? Huh? When you hear get what comes to your mind? Who are the geriatrics? No. Elderly people. Elderly. Just as we have pediatrics. This is what elderly, right? This is what true of us. Comma pediatrics, the one you know, right? Comma pediatrics. Comma Nephrology. What is it all about? Nephrology. What is it? Is it all about? Nephrology. Nephrology.
Kidney.
Kidney. God bless you. What's your name? What is going here, quiz?
18.
18. It's from nephron, right? What is nephron? What is nephron? What is nephron? Who knows what is nephron? Nephron is what? Nephron is kidney. Hey! What is nephron? What are you doing? What is nephron? Nephron is his lungs. Okay, now.
The kidney that helps to filter.
That's the functional unit of the what? Kidney, right? Yes. It's the unit, right? Yes. Am I communicating? So, hey, there are many of them. There are many areas in what they can do. What? That's why today now we have consultant pharmacists in hospital setting. We have consultant pharmacists in hospital pharmacists today. Presently now we now have consultant pharmacists. And what does it mean that they now have different fields, right? Within the hospital or pharmacy, they have different fields they focus on. Am I communicating? Now, gradually now you start having them in private community pharmacy. But for now, they've assumed their place in what? Hospital setting. Are we together? It's basically like these government hospitals now, they have the consultant pharmacists. So these are different areas they can. We have those in urology pharmacists. Am I communicating? They are within them. Yes. Urology. Are we together? Find out. She will tell us tomorrow what they specialize on. What urology is all about. Okay, brain. Wow. Clap for her. Down your hand for her. Clap for her again. She will tell us tomorrow. Clap for her two times. Why she tell us tomorrow? She said spinal cord and brain. Wow. All right, so let's continue. Their roles.
This one is full stop.
Yeah, continue. Their roles involve. EJ, focus. After you ask me, sir, what did you say? Sir, I didn't hear you, but you are gisting. Their roles involve providing comprehensive medication information. Their roles involve providing comprehensive medication information. Providing comprehensive medication information and contributing to the hospital's overall management. And contributing to the hospital's overall management. And contributing to the hospital's overall management. These pharmacists, these, plural, these pharmacists, you're tired of writing as well.
Sammy, I'm not tired.
Okay, that. You can never get tired in Jesus' name. These pharmacists play crucial roles in various healthcare settings. They play crucial roles in various healthcare settings. So we have different healthcare settings. Hope you know. We have the primary setting, we have the tertiary setting, and we have the what? Secondary setting. So in different aspects. So far there's clinic there, we have pharmacy, they play crucial roles. Very important. Without them, remember I told you that without them, I don't know what hospital will look like. True or false? It's false. It's true. You say it's false. It's alright. Okay, you're joking. She says she's joking. Are we joking here? So she's joking. They play.
They play my hands.
Who said that? Alright, so these are the rules of what? Are we together? So now we are done with rules of what? Pharmacists. We are what? As in done. Done. So I want us to go over to pharmacy technician. Let us now do what? Go over to what? Pharmacy. We start from who a pharmacy technician is. Okay? Are we together? We must be here. Are we together? Sorry, my dear. Are we together?
Yes.
Good. So I want us to look at pharmacy technician. We have an overview of who a pharmacy technician is, because that is your area, right?
Yes.
So I will dwell in it, and so you understand why you are here. Why I started with pharmacists like this? You can't be talking about, because we are going to work with what? Pharmacists. So you need to understand who a pharmacist is before you now. If you understand who a pharmacist is, that's when you can work well with what? A pharmacist. If you don't understand who a pharmacist is, you will see him as your what? Rival. True or false? You see that man that is always controlling you, or that woman that doesn't want you to rest, telling you to go and count drug, telling you to go and carry this thing. Who is he? Is it because he spent 5 years? Me, I spent 3 years. I don't know. You won't understand. Am I communicating? So, but if we do it this way, you understand and appreciate who you are working with. The same way pharmacists need to do what? Understand who a pharmacy technician is and know the role. If you understand, if you are in a type of relationship, you know, pharmacist is a relationship, you know.
Yes.
Now, if you are in a relationship and I understand my roles in that relationship, and you understand your roles in the relationship, we'll be happy, two of us.
Yes.
Even if sometimes I may do your own work. Yes, let's assume now the pharmacy technician is not on ground. Maybe something happened, or maybe he or she went out to do something, and the pharmacist is the one on ground, and the patient comes. Yes, the pharmacist knows that this is not my duty, but this person cannot be left unattended. He will perform his own duty and perform your own duty. True of us?
True.
And because the pharmacy technician understands his or her role, if he or she comes back, he will be happy, right?
Yes.
And say, "Farm, thank you very much. I appreciate." True of us?
True.
But someone that doesn't understand his duty, what will he even understand that somebody helped him out?
No.
He will not understand it. The same way, a pharmacist may not be on ground. But on coming back, the pharmacy technician is doing his own work and doing the pharmacist's work. A pharmacist that understands that this pharmacy technician is doing is not his duty, we thank him. Hello, they thank you very much for what you were able to do. But the one that doesn't understand will be doing boss. What are you doing here? You don't know that you should do. True of us, that person is either the person is naive. You don't know anything. You don't know who his role, or he just being arrogant and wicked. True of us. But a person that understands will always do what? Thank you for what you did, and you'll be happy that somebody above you in hierarchy is even thanking you. That is joy you have. And next time you try to do what? Help out more.
We are coming by 12. We are coming by 12.
The time this class is fixed for when to when? 11. I have 28 more minutes. Oti. Is it 12 that you should come?
Yes.
Okay, let's continue. My business is that I'll leave here by 11, so whether he's coming at 12,
Yes.
it's not my issue. Alright, let's go. So who is a pharmacist? Sorry. Pharmacy technician. Let's go. Let's put it down. Ask that question. Who is a pharmacy technician? Ask yourself that question. Write it down. Who is a pharmacy technician? With big question mark. Who is a pharmacy technician? You're not serious. Who is a pharmacy what? Technician. Let's go. A pharmacy technician is a healthcare professional. A pharmacy technician is a healthcare professional licensed by the Pharmacy Council of Nigeria. Pharmacy. Some of you are telling me we are in your quiz. Some you are telling me that PCN is pharmacist. What I explain here in your class. Pharmacy Council of what? Nigeria. Licensed by what? Pharmacy Council of what? Nigeria. I said that a pharmacy technician is a healthcare professional licensed by the Pharmacy Council of what? Nigeria. And work under a pharmacist's supervision. And work under a pharmacist's supervision, performing various pharmacy tasks. Performing various pharmacy tasks maybe you are hearing it from me before. Performing various pharmacy tasks that don't need tasks, plural, that don't need a pharmacist's judgment. Performing various pharmacy tasks that don't need a pharmacist's what? Judgment. Do you understand this? Yes. It's not all tasks in pharmacy that require the pharmacist's what? Judgment. True of us. Do you need a pharmacist's judgment to know that the drug supplied by a company should be taken to the drugstore? Do you need a pharmacist to make that decision for you? Am I communicating? You don't need, right? Good. There are lots of tasks in pharmacy setting that don't need a pharmacist judgment.
Like
yes, from your onboarding training. From your onboarding training, you are okay. Make sure that you check the expiry date of the drug. Do you need a pharmacist to help you to get a decision? And there are some non-pharmacist tasks that if pharmacists start doing, it will become a distraction from actual patient care. Hope you know.
Yes.
Yes. When a patient that needs serious intervention, pharmacist is busy carrying carton up and down. Without pharmacy grow, it not grow. Patients are lined up there, and pharmacist is busy counting vitamin C.
100 naira.
Someone that needs his expertise on what I should do to help me save my life is counting vitamin C. Does it make sense?
No.
But is vitamin C needed to be counted?
Yes.
Do you know understand what I mean by some pharmacy task that don't need pharmacist what? Judgment. That's why we need pharmacy what? Technician. Then there are some other minor things that you don't need serious intervention that you can also do what? And when your pharmacist has assessed you and see that this guy, even though the person is a pharmacy technician, but he or she has helped him or herself to grow in pharmacology, in compounding, pharmacists will start bringing you in some things because he know that you are loaded. True of us.
Yes.
But if they assess you and say that you are empty, and they are not only that you are empty, you imagine how you were able to pass this course and graduated. That's one big question mark that will be in his head. Then, to even make it worse, he tried to bring you in and try to say you're not even interested. That one is even the worst. He will lose confidence in you. In fact, your work is to be carrying carton up and down only. Simple. There's no magic about that. There is no magic about that. Even himself, he may even be afraid to allow you count drugs for him because you may not even count well. That's why you should build yourself. You should do what? Build yourself. You should study. You should study. It's not just about passing the exam, but about having something inside you. Know what you are doing. If you are any course you ask yourself, why am I doing this course? You try to go extra mile to study, do more research to find out what importance of this course or this topic to my training. There's no course we are doing here. All of them we have reason. The PCN has a reason for putting them in your what? Curriculum. It's not about passing the exam. Find out why it's there. Try to appreciate it. Go extra mile from what you are given in class. Study. And if the pharmacist you're working with will have this confidence in you and this person knows what he's doing. Even if some even leave you and travel. Because they know that you know what you are doing. And they know that if you encounter a serious issue that you will contact them. Because you know what you are doing. Am I communicating? So please, it's important to do what? It's important to do what? You work and develop yourself. Let's continue. You can put a paragraph. Paragraph. Still under who is a what? Pharmacy technician. Remember the question, who is a pharmacy what? Technician. We have defined. So paragraph, continue writing. Paragraph. The training of a pharmacy technician. The training of a pharmacy technician lasts 3 years. The training of a pharmacy what? Technician lasts, you can put last for 3 years. It's okay. 3 years. And it includes classroom learning, practical experience, which you go in your second year, classroom learning, the one we are doing now, right? We are classroom, right? Classroom what? Learning. comma, practical experience, the one you go officially in your second year, second semester, and the one you do privately on your own, even when in school. Those that are already working somewhere, is practical what? Experience you are getting, right? Good. Practical what? Experience. And laboratory what? Teaching. From your second year now, you start entering the lab to do your dispensing practical. Laboratory teaching. Laboratory what? Teaching. For your second year, you start doing your practicals, right? Not even second semester, right? Because yes, for second semester, you start doing your practical, basic sciences practical. Then you now second year now you now start your dispensing what? Practicals. Are we together? Then full stop. Another paragraph. Pharmacy technicians fill prescriptions. Pharmacy technician feels is not feeling your emotion. Feeling as to feel something. Fill prescriptions, comma, package doses of medicines, comma, control inventory. The filling position means when a patient comes. I will explain this. Let me just write. Control inventory, comma, and keep records in settings like community pharmacies, hospitals, clinics, home care, and more. Full stop. What are you even doing? This role. See your face. What is this? No, continue. It's not a paragraph. Any issue? Singular. This role is a good starting point. For a career in the pharmaceutical industry. This role is a good starting point. For a career in pharmaceutical industry. Comma. This role is a good starting point for a career in pharmaceutical what? Industry. Comma. Providing essential training for becoming a pharmacist. Providing essential training for becoming a pharmacist. Sorry, my dear. For becoming a what? Pharmacist, comma. Sorry, for becoming a pharmacist or working in different pharmacy settings. Pharmacy settings. Or working in different pharmacy settings. Now let me explain. Let me do what? Explain. Now listen. It's clear now. Pharmacy technicians are licensed by what? Pharmacy what? Council of what? Nigeria. Then they are there to perform duties that are what? Non-pharmacy tasks that are not that don't need pharmacist what intervention or decision. Am I communicating? As the case may be, or judgment. Of course, we are here now. Yeah, we spent 3 years here, right? Yeah. In summary, that 3 years revolves around classroom work, lab work, and experience outside here. True of us? Good. Now, it doesn't end there. Sorry, madam. It doesn't end there. Traditionally, the role is to perform what? Is to do what? Package what? Doses of to fill precision. Now, let me explain. You know, I say I will explain what is fill precision. When, for those that there's a question I asked you about in your quiz about when a precision comes, who satisfies it? So I'm telling you, medical doctor. So we are saying right what I don't know. How can a doctor prescribe in his office and come back in the pharmacy to do what? Certify it? Does it make sense? So the prescription comes to the pharmacy, right? Then the pharmacist look at the prescription first. Look at it, check one or two things on the prescription. They check, align what is in there and what they have. Am I communicating? If it is a certain where they have costing pharmacies, costing one. There's some hospitals that have pharmacies that cost. And it's even best for a pharmacist to cost. Because there are some prescriptions that will come. The pharmacist already know what they have. I know how we can combine what they have to help patients get this drug cost effectively. You know what I mean by cost effectiveness? Achieving effectiveness with the minimal what? Cost. Am I communicating? You certify and check if there is any possible interaction, drug interaction in the what? Prescription. Or what he thinks that doesn't go well with prescription. If there's something that is not that okay, he will go back to what? The doctor. And discuss with the doctor to make some what changes. Then after everything and the prescription is okay, the pharmacist will do what? Certify it. The pharmacist technician will now collect the prescription and go and fill it. What is filling? The pharmacist technician will now go to the shelf and start bringing out those medicines as stipulated in the what? Prescription. You bring all of them out and table it to the what? Pharmacist that dispenses. In a hospital where we have so many pharmacists, these things are divided. There are pharmacists that cost. There's one that assess it. There's one that when the pharmacy technicians are done, there's one they give it to. Is one that will not sit down with patients and counsel patients on the medication and everything the patient need to know about the drug and write the dose. Before the exam, we write the doses on the package and write the dosing and any other precaution, whatever that any other thing that they need to know, auxiliary stuff that they need to know about the drug. The pharmacist will now, when he or she table it to the pharmacist, he will now look at it and now speak to the patient and give the medication, hand the medication over to the patient, who will now go home. During this step, if there is any error, it will be tracked. It will be easily noticed. But when they don't want to employ pharmacists, you may even see pharmacy technicians doing all these things. Where they will employ only one pharmacist. Will the person kill himself? Patients are lined up. Will he be able to attend to all of them? Would this? And when you work in pharmacy, especially a hospital, they will deal with you. Patient will deal with you. Because the person came since morning and he's waiting for a doctor that will be busy with other things. I don't know whether it is official or not, but the point is that some of them will end up coming late. And when they now come, before they will not see the patient, The patient will leave the doctor's office around 12. He's already agitated and angry. Then he will now go to air. They were annoying him there too. Then he will now go to billing for payment. That's where the entire anger will start. It will start steaming. Then he will now come to the pharmacist. There's only one pharmacist that is on duty, and they line up. This will be around after 2. They have school run to go. The kids are hungry. Some that took permission from their work office has spent 3 hours there. They already taken off the lie. They will tell their boss, and you are there pressing your phone. Maybe you want to find out this thing. What is the brand name of this thing? To him or her, you are pressing phone. He will deal with you. He will rain curses on you. And if you're not careful, you will start reacting back, giving feedback, responding. Then the management will now look at you and give you suspension. You go home. So you have to be patient with the patient. Am I communicating? No matter what they are saying, you understand that they are hungry. Just have that understanding that they're not happy. Because patients are not actually what? Patient. Because patients are not actually patient. So be patient with them. That's the only way you can survive. If not, you'll be having issues with patient and the management. Maybe the administrator will be in his office. I'm looking at the CCTV. Yeah, I say, when you are done, he will call you and ask you, are you chasing them away? What are you doing? How do we pay you your salary? Then you understand the importance of being patient with them. It's not easy, but you have to do that. Am I communicating? So that is these are the process of what it takes to, what I mean by filling a what? Prescription. Are we together? Are we together? So that basically, then of course now you package now. I've mentioned that. Then you control inventory, both stock taking, and what inventory is inventory is what you have, right? The total of the stock you have, the drugs, the medicine you have, medical devices you have, and other things you have in your work pharmacy. So you take control of how they come into the. If that one is squarely your duty. You control the inventory, how they come into the work pharmacy. What and what is dispensed, and how the one that are close to expiry and the one that is remaining. These are the information you should be giving on daily basis. The pharmacy can just call you, please. What is the cost? What is the stock level for this particular medicine? You should be able to do that. Am I comfortable? Please give me the list of drugs that will expire in the next 1 month. You don't need to spend up to 5 minutes to give that information. Am I communicating? That's your duty. Please give me information of the drug that we have purchased so date. You are the one. Get it immediately and give. Am I communicating? So you have a lot of responsibilities. Without you, the pharmacy will just look like, I don't know how it will look like. So you have not fully performed those roles well, and you're looking at the pharmacist you have issues with. Where our duties are there. Am I communicating? Ask.
My question is end of the month report. Is pharmacist, is pharmacy technician, is he supposed to write report, end of the month report?
No, your duty, where there's a pharmacist,
Yes.
where the pharmacist is on duty, your duty is to give the person the information you need to prepare a report.
So, but if the pharmacist is not there, can a
If
pharmacist?
there's no pharmacist there,
Yes.
you still do it now. You see me? Is it the market woman in which will do it?
You know,
If there's no pharmacist there, you do it.
you know why I ask this question?
Ask.
The question is that the people that I work with,
Mm.
I do report more than them. They are pharmacy technicians.
Yeah.
But if sometimes I will last month now, it's still waiting for me to come and do it, which I have already told them or teach them how to do it. You understand? But when the training will come for us to go to Abuja, do flight for us, they will present themselves as pharmacy technicians and they will shift me at the back. Say, after all, you are not the pharmacy technician.
Who is doing that?
In my department, mine.
Wait, is it a pharmacy technician that gives you for?
No, pharmacy technicians I'm with. They will
We
tell
do
me,
what?
they will tell me that the report, Madam Mrs. Waka, you are there before us. You will do the report. I will do the report. But when Abuja will call us for training, they will say, after all, she's not a pharmacy technician. That they will go for the training. When I am the one that is writing report, you know the worst part of it. After writing the report finish, they will come at the back or at the end of it and put their name, pharmacy, so person. Why I am the one that wrote it.
Okay, sit down. Okay, hey, I feel happy. I feel happy. I feel happy. I feel happy. Hello.
They do that thing a lot.
Now listen. Now let me clear your doubts. Hello. Hello. Let me clear your doubts. Are we together? Are we together? Writing reports and getting information for writing the report are two different things. Hope you know. If there is a pharmacist there, the pharmacist will still tell the pharmacy technicians under him to give him what information they have been working with. He will now sit down and prepare reports and put his name and submit. Then if he trusts that they can do it, maybe he would have taught them how to do it, and are doing it well, he may as well ask them to do it, the report, and they will do the report, and they look at it. If it's in order, they will sign and put their name as those that do the report. It is those that their name appear in the report that they come for training. They are the focal person. Are we together? So there is no pharmacist there, and you are not a pharmacy technician. The highest cadre there is pharmacy technician. They are the boss there. That is the program. We know them as the focal person because the establishment did not employ pharmacists to take care of it. So they are the focal person there. Now they will get information with using you as the next cadre under them. Wait. Then when you now get the information, they look at it. Probably they trust you that you can do it better. So you prepare the report and they put their name and send. If you put your name and send, it will cause issues there because the program doesn't know you as a focal person. So whatever you prepare, they will still put their name and send. They are the one that prepare the report. It's not you. Sorry about that. And if you say you will not prepare, and they have the power to sack you, they will sack you. They are your boss. Sorry about that. If they have the power to sack you, they will sack you. So judiciously keep doing your work. Sorry. Is it 11? It's 11. It's not 10. No, okay. What? You are there. You are there as what? Okay, pharmacy assistant. Yes, she's. Wait. Just wait. Let me go, please. Please, just wait. She's there as pharmacy what? Pharmacy assistants are under pharmacy technician. I'm sorry about that. But you are doing the right thing now to upgrade. They didn't pay them. She rushed here and bought the form. Hello? That is the best way to hello? That is the best way to show that you're not happy. It's not by quarreling with them. If it invests you, go and study. Now again, after you are done now, when you are working on that pharmacist and you see what you are angry, you go and enter university and study what? Pharmacy. Then maybe you study B farm and you see what those with Farm D are doing. You angrily go and buy for Farm D and continue. That's the best way to show you are what. And it's not by quarreling or fighting with them. Sorry. It's well. I feel her pain. Yes, and she's growing. I think we'll stop here for today. Tomorrow we'll continue from where we stop. So tomorrow we go to the roles of what? Pharmacy. Okay, Thursday. Wait, hello, one house, please. Listen. I'm about to give you important information now. Tomorrow now, you hello. Wait, now let me go before you start. You don't even allow me to finish tomorrow. Sir, tomorrow. What happened tomorrow? All right, no problem. Thursday we continue. All right, remember our next quiz is on Monday next week. Monday, yes. It's Mondays. Hello. That one we did was because I was directed to do it on that Thursday. So that's why I'm not doing anything today. It was supposed to be today. So our quiz is on Mondays. Mondays we'll continue here. All right, thank you very much. Huh? Hey now, you can do from this threat. Yeah. All right, thank you very much for your attention. See you next time. God bless you.